Next, we have a short presentation on the status of the Passaic County Health Department for the year 2018. We're honored to have with us our Health Director, Charlene Phil.
Thank you, Mr. DeNova, and thank you, Freeholder Bartlett. It is my pleasure to present to you the status of Passaic County's health for the year 2018. This is a requirement under practice standards, and it will be done every year going forward. Sitting with me is Joe Pizzillo, the Superintendent of Mosquito, which is one of the divisions of the Department of Health. The next slide just has an overview of the staff. There are about 30 full-time employees in the health department. The next slide speaks to the 4 divisions that comprise the health department: the Emergency Preparedness Division, Environmental, Mosquito Control, and Recycling and Solid Waste. And in parentheses, I have the term I'm going to use for each of them: BT, CHA, MC, and RSW. This slide speaks to the mission and vision of our department, which is basically to serve our community through the delivery and promotion of services focused on improving and protecting the health of our residents and the environment. These are the values that brought the vision and mission that you saw in the previous slide. And we are committed to assuring the preservation, protection, and promotion of health, well-being, and quality of life for Passaic County residents through partnerships that strengthen the public and environmental health infrastructure. So beginning with the BT team, this is the team that's responsible for emergency preparedness, and one of their responsibilities is to manage a group of volunteers called the Medical Reserve Corps. Last year, we got to almost 400 volunteers, and we're responsible for training those volunteers and having them ready in order to be deployed anywhere in the United States in the event of an emergency. In addition, the BT team also provides services to employees and residents of Passaic County, and this slide gives you an overview of some of the services that they provide. The CHA team, which is an agent of the DEP in Passaic County, it's really more of a regulatory agency, and so their focus is on inspections and issuing notices of violations if necessary. We pride ourselves on trying to provide education first, and when education does not work, that's when we do notices of violations. So this particular team collected over $17,000 in penalties for last year. The mosquito control accomplishments will be presented to you by Joe Pizzillo.
Thank you. So 2018 was a trying season for the mosquito control division. However, we persevered. Some of the difficulties we faced were record levels of precipitation, which led to excessive mosquito nuisance, which led to a record number of requests for service from our county residents. 574 requests for service that came into, mostly through the telephone, but increasing use of the Passaic County NJ.org website, submitting the mosquito complaint form. In almost all instances, we responded to all those requests for service within 24 hours. One of the approaches that we employ to control mosquitoes involves the use of biocontrol. Those are fish, mosquito fish. In this case, we stocked, in 2018, we put 10,000 fathead minnows around in standing bodies of water throughout Passaic County, which provide ideal larval control of mosquitoes. It's a nice alternative to pesticides and chemical applications. And lastly, there is proposed legislation, Assembly Bill 4559, that would be potentially adding tick control to the responsibilities of our mosquito control division. So rather than kind of wait and see what happens with that, we a proactive approach and jumped on board with the New Jersey tick blitz in 2018, where we learned about tick biology, tick surveillance, and tick testing. And we actually went out and performed our very first tick drags in Passaic County in May last year.
What's a tick drag?
A tick drag is basically dragging a cloth through the tick habitat and looking at that cloth and removing the ticks from the cloth. They attach themselves onto that, and then we bring the ticks back to the laboratory and identify them to species, and then we can eventually one day hopefully be able to test them for disease.
Of course, the state is going to pick up the cost of the extra tick.
Well, that's yet to be determined.
Oh, I didn't see Assemblywoman Sumter is here in the audience. I didn't realize you were here, so.
No pressure.
Thank you, Joe.
You've been pretty successful. With the mosquito thing, right?
Keep going. Thanks, Joe. The Recycling and Solid Waste Division presented over 1,000 education programs to almost 30,000 students in every single Passaic County municipality. In addition, there were shredding, computer and electronics, recycling programs throughout the county, in 14 of the 16 municipalities. One of the other highlights from that division is the first ever bicycle and sewing machine collection event. What was interesting about this particular recycling event was that all of the sewing machines and bicycles that were collected were refurbished and donated to people who needed, whether it is means of transportation, i.e. the bicycle, or a sewing machine, provided women the opportunity to have something that they could do to earn an income. This is who we are. This is a picture of a department, about 30 of us. I just wanted to give a shout out to my whole team and thank them. The other part of this presentation is going to be a brief overview of the county health rankings, because that is something that comes out every year, and that is supposed to be linked to the services that we provide. So the county health rankings, this slide tells you what it is, and each of you has a copy of that. Using health factors as described herein, so adult smoking, obesity, and so on, they come up with some health outcomes using data. I selected these examples because I thought that they were important ones for our community. And I'll speak to two of them, the access to exercise opportunities, as well as the Food Environment Index. Passaic County is actually in a very good place when it comes to exercise opportunities. Every single resident of our county is within 2 miles of whether it's a gym or a park or someplace where they could work out. And according to the data, that's 99% of the residents in Passaic County. And we've outclassed every single county in this particular area. So I wanted to bring that to your attention. The other one I wanted to bring to your attention is a very interesting one to me, which is the Food Environment Index. And food environment speaks to food insecurity, which means that people may not have access to proper food, which is going to affect their health. Several years ago, United Way had conducted a survey in our community to identify whether or not we have what's called food deserts. And we have several of them throughout the county. And basically what it is that people have to have access to healthy foods in order to be healthy. And access includes money, it includes geography, and I'll give you an example about the geography piece. In South Patterson, we have a tremendous amount of farmers in the farmers markets with fresh fruit and great vegetables. But if you live on the east side of Patterson, or in any other place where you might need 2 buses to get to that place, then you're as food insecure as someone who is not living in a place where food is readily accessible. In addition, if the only places you can find food is in a corner store where the quality of food might not be there, and the location of the food in the store would not make it a good choice for you, then you are also in a food desert. It is not accessible to you. So I wanted to kind of give you an overview of some of the things that we look at as we talk about the health of our community. Overall, for our health factors, those are the things that impact our health outcomes. We have some issues that we need to address, and I just highlighted a couple here on this slide. The severe housing issue, I think we're all aware that, that rent is very high and the quality of the housing is not necessarily there. And so it's one of the issues that we need to continue to address. But something that we never think about in terms of a factor affecting our health is commuting. How long does it take us to get to work? And obviously when you look at some parts of our county, people have a longer commute. But again, remember that if you're on one side of the county, maybe it's not geographically far in terms of mileage, but your access to get there could be as far as if you were coming from very far up county. So those are the things that we are concerned about as far as what affects our health overall. Clinical care is another access issue that we have in Passaic County. These numbers represent, the first column represents Passaic County, the second column the top counties in the United States, and the third column New Jersey. So for primary care physicians, there is one primary care physician for about 1,700 people. In the top US counties is about 1,000. In New Jersey about 1,100. And the goal in public health is to have a primary care physician for about 1,000 people. So we have some work to do there to encourage people to come into our county and to set up their practice there, here. Another area, as you see, is dentists. The other one I'm going to highlight, well, to our mental health providers, and I'm sure there are people in the audience that can speak more to that. But if you see, we have almost 1,000 to 1 mental health providers. That's throughout the county. That means 1,000 persons to 1 mental health provider. The goal is around 300. The best counties in the country have about 330 patients to 1 mental health provider. And that includes psychiatrists, psychologists, and social workers down the line, not just the psychiatrist. And the sad one to me is the mammography screening as well. And this particular line speaks to 58% of eligible women in Passaic County were able to get screenings in 2018. The top US counties, the number is 61%, but in New Jersey, it's 71%. And as you know, New Jersey is a high income state, but this particular item is not really related to income because the Department of Health has a very good program called the SEED program that provides access to every woman who needs a mammography. And so it's just a matter of getting the word out there and providing the access and understanding that people know that they can get the service for free and that they can utilize the service. I like slides, so I only put one in there because everybody doesn't like slides the way I do. So, but this is a good one. So as we look at all the data, one of the things that we talk about, not just in the United States, but globally, is called years of potential life lost. This particular slide is exciting to me because the red line represents Passaic County. And as you see, the red line is going down. And what does years of potential life lost means? It means that the benchmark that we look at is that most people will live to approximately 75 years old. So anyone who dies before they turn 75 years old is living a shorter life than we expect for many other reasons. But in Passaic County, we're actually living longer. So we're doing something right, and I thought I wanted to let you know that this is one of the positive areas for us. The next slide talks about, I mentioned earlier, the health factors. These are the health outcomes. How did those things affect people's health in the final analysis? And again, you have all of these slides. So I'm just going to move on. The next couple of slides I'm going to talk about are the ones that tells us, now that we've identified what the issues are, what are we going to do about it? And so here are some action steps. We're going to work together with our partners. We continue to do needs assessments. Not only do we assess the needs, but we assess the resources that we have access to provide those needs. We identify, we prioritize, we act on what's important, and then we reevaluate. Sometimes we have to change our focuses based on what we find. And so these are some things that we're doing. When I say we, I mean the public health officials in Passaic County. Earlier I mentioned about the importance of our partners. And none of us in public health can do this by ourselves. We rely on our partners throughout the state and throughout the county. So we have to identify partners with shared vision. Community development is a big part, community members, educators, government, and so on. All of us play a role in the health of our community. And so we in public health, we work very closely with a number of partners. For example, United Way. I underline the Food Policy Council because they're the ones who had worked on identifying food deserts, but also building a culture of health, which is a very big program that we are part of through the Robert Wood Johnson Foundation. Community health needs assessment done by St. Mary's, St. Joe's, the Passaic County Public Health Partnership, which comprises all of the health officers and their teams in the whole of Passaic County. The North Jersey Health Collaborative, which covers 7 counties in New Jersey, in the northern part of New Jersey. And obviously St. Joe's, particularly the Passaic County Health Collaborative, which comprises of 18 different agencies in Passaic County who have the shared vision of providing services for our residents, excellent services as we can. So we're looking at this, we're looking to leverage activities, leverage partners, and try to really not do the same work. So there's a lot of overlapping, and we're trying to make sure that each of us is able to provide services in a particular niche that our community needs. Lastly, some of the initiatives that we're involved in include the Building a Culture of Health Blueprint for Action, which is a document that identified each single area that we need to address, how are we going to address it, by what time, and what are we going to do about making it happen. The Community Health Improvement Plan, which we call the CHIP, which was done by the Passaic County Public Health Partnership, where after we identify, we again create goals and objectives and actions for each of those objectives, and so on. And all of these partners and all of these initiatives work together to improve the health of our community. Thank you. Thank you.
Thank you very much, Dr. Jonas. I was surprised by by how far behind we are on the number of physicians, number of providers per citizen. I would think in a sort of urban North Jersey area we'd be closer to par with the country, but that's troubling. Does that account for close by locations like Fairlawn?
So, no, that particular data refers to only practicing within our county, because a lot of our residents access health in neighboring counties, but that particular one, the data is specifically for within our county.
It'd be interesting to think about how to improve that. Anybody have any questions for Dr. Gundy? Thank you again very much.
Thank you.
Nice job.